Well, if it's a Wednesday, it is time for another About Mansfield Consumer Advice Series episode. I'm Steve Casillo. Appreciate you being here today. And you, chances are doing one of three things. You're either watching this live on Facebook, you are watching the video replay either on Facebook or YouTube or LinkedIn, or you're listening to this podcast on your favorite podcast platform. In any event, whatever you're doing today, we appreciate you being here today. And today, as always on Wednesday, we bring in our expert on all things health, or at least here on this podcast, and that is Dr. Jordan Adams. Welcome back to About Mansfield.
Hello, good morning.
And today she's in the studio, which is awesome. Usually she's at home or the office. Today she's in the studio and actually right there over my left shoulder. And today, as we've been doing the past couple of weeks, we first started with the first trimester of pregnancy. And then the last episode we did was the second trimester of pregnancy, and which kind of leads to the next one, which we're doing now, the third trimester of pregnancy, and how that relates to the pregnant woman's health and the baby's health, I would assume, right?
Yes, absolutely.
Okay. So let's start with, first of all, is there anything that we wanted to recap from the second trimester to bring into the third trimester?
I think the biggest thing would be in the third trimester, which typically starts about 28 weeks and can go up through your estimated due date, which is typically somewhere around 40 weeks. But remember from previous podcasts, that can range from 37 to all the way to 42 weeks. But we talked a little bit last week about just some of the physical discomforts that start to happen during the second trimester due to postural changes. And these do continue throughout the third trimester because growth rate increases in that third trimester.
All right. And as we start getting toward the it's time to deliver the baby, and there are a couple of different ways naturally. One of them is where the head comes out first, but then the other part is a breech presentation. And is there a way that for yourself, say a chiropractor, can help in breech?
Yeah, and breech is a really good topic to discuss with third trimester. And typically this is when patients who've been told they have a breech baby may want to pursue chiropractic. But what I do caution all my moms and tell them is that chiropractors do not turn or flip breech babies. I want to be very clear about that. The role of the chiropractor in any pregnancy is to help facilitate more balance in the pelvis. And so we did talk about this last episode, is by looking at the neurobiomechanical function of the sacrum, of the pelvis, and of the supporting ligaments and muscles. If we can get the pelvis to a place of ease, that can encourage more space for baby to go head down. However, there can be limitations with where the placenta is inserted or where the cord is wrapped, if the cord is wrapped, or other anomalies that maybe could prevent baby from going head down. So there's a lot of factors that can come into play. But again, the goal of the chiropractor is to create ease in the pelvis and create more space to make mom more comfortable and optimize, hopefully, position for baby.
Okay. So there's a lot of planning going on. It's not just, okay, this. And, well, how do you know if a baby's going to be born breech or not? Is that something that can be determined during that 9th month?
A lot of times your provider, whether that is your midwife or your OBGYN, they will be doing ultrasounds, or if it's your midwife, they'll do palpation around the belly to determine baby's position. They will let you know closer to typically somewhere after the 30-week mark if there are any concerns. And they do tend to track that if there are concerns to ensure baby does start to flip head down. Some babies can flip as far along as 37, 38 weeks, but typically they want to see baby head down by the mid-30s.
Okay. One of the things that I remember, now this is 25 years ago, when my wife was pregnant, in the third trimester was heartburn. And is this something that can be avoided? Something that, is there a way that a chiropractor can help out with heartburn during pregnancy?
So this question can come twofold. So
Okay.
heartburn can be contributing through some musculoskeletal or diaphragm potentially restrictions, because you have to keep in mind too where the esophageal sphincter is connected to the stomach, the diaphragm is a big component of that. And so when you have baby growing up, putting pressure on the sphincter and on the diaphragm, if all of those parts aren't working appropriately, then the sphincter could have some issues of maybe staying open, plus you have relaxin, and that can cause stomach acid to come up into the esophagus. But if you're well adjusted, if that's not an issue, you can look at acidic foods. Maybe you're noticing a trend. If you're eating tomatoes, like spaghetti or pizza, and you're having heartburn after that, you could have a dietary modification that we can help you navigate to help decrease your heartburn. And one thing a lot of moms have told me recently is that they're getting amazing relief from apple cider vinegar in helping to decrease their heartburn.
Huh. Okay. Apple cider vinegar. We talked about vinegar off the air just before coming on here. And now I know that you are a big proponent of yoga. And does yoga work itself into the third trimester?
Yes. Well, yoga can work itself into anyone's life, regardless of if they're pregnant or not.
True.
But when we're dealing with the third trimester, we really want to make sure that we are taking care of our body and of our mind. And that can come into play whether through mindfulness exercises and visualization, getting prepared for birth, and really training the body in systematic relaxation. So relaxing the body from the crown of the head all the way down to the toes, and just figuring out, practicing and playing with where you're holding tension in your body so that you learn where you need to release, where you're holding that tension, because that can actually help aid you when it gets closer to labor.
All right. And yoga is not only stretching, but it also is the practice of breathing.
Yes.
And breathing also plays an importance in pregnancy as you're leading up to due date.
Absolutely. We often hear with pregnant women, and I know I experienced this myself, is breathing becomes more challenging. Again, just like we talked about with the stomach, that goes to the fact that we have an increased pressure on this abdominal cavity until baby drops.
Yeah.
So once baby drops further along in the third trimester, a lot of women say they breathe easier. But in those early weeks of the third trimester, what I like to work with my moms on is really practicing a full diaphragmatic breath, so that we're, instead of breathing up here because we're restricted, which a lot of women breathe from their chest, we learn to breathe from our rib cage, and we learn to embrace a lateral expansion, which means a side-to-side expansion and a front-to-back expansion, so that we're helping our body get a full ability to breathe.
So what you're saying is, in your third trimester, even though you're holding 6, 7, 8 pounds, you don't have to suffer through it.
You don't have to. It just takes some consistent effort and practice and reminding yourself of how to breathe.
In the minute or so that we have left, is there anything that you wanted to add or to recap?
I don't think so. I just think, in the third trimester, really checking in with yourself on how you're doing, giving yourself, we talked about this in the first trimester as well, but giving yourself permission to honor where you're at and maybe what you need can go a long way. And actually, no, I do have one thing. My sister and I were talking about that this weekend, and we have a friend who is looking at getting pregnant in the next year, and we were joking with her and telling her, okay, go out to eat as many times as you want. Go to the movie as many times as you want. Like, if you haven't done that yet during pregnancy, do that now.
Oh my gosh, that's excellent advice, because you're not going to do it for another 2-3 years.
Or 5.
Or did you say you said 5?
4 or 5. I haven't been to the movies in like 5 years.
If someone had more questions about pregnancy, whether it's first trimester, second, third trimester, if someone wanted to reach out to Dr. Jordan Adams at Calibration Chiropractic and Functional Health, how can they reach out to you?
The best way has all of our information is on our website, and that is calibrationmansfield.com.
We do these 10-minute nuggets of information every Wednesday. And again, reach out to Dr. Jordan Adams. She is with Calibration Chiropractic and Functional Health right here in Mansfield, Texas. Dr. Jordan, let's do this again next week.
See you next week.